it has become conventional to consider carriers to be multifactorial. However, although the multifactorial concept aids understanding, it is crucial to understand that caries is caused by dietary sugar intake. All other factors are dependent on dietary sugar or only modify its effect. Thus, the cause of the caries is eating refined sugars. There are certain essential requirements or conditions for the development of dental caries. Until these requirements are met, there will not be caries initiation and progression. These requirements are: number 1, there must be presence of bacterial biofilm. Second factor is there must be cariogenic or acidogenic bacteria. Third factor is there must be plaque biofilm stagnation sites. Fourth factor is susceptible tooth surfaces must be present. And fifth factor is fermentable bacterial substrate, means sugar must be present. And sixth, there must be enough time to act all these factors. For the prevention purpose, if you remove any one of the above mentioned factors, you will halt the caries progression process. We will discuss all these factors in detail one by one. This detailed discussion will help you in answering the question in part 1 as well as in OSCE and 𝗬𝗶 in part 2 of the ADC exam. This will also help you if you are preparing for ORE or NEET MDS or NDEB exams. If you have not subscribed to this channel, I suggest you do it and share it with your friends for maximum benefit. The more you discuss, the more you share your knowledge with your friends, the more benefit and clarity you will achieve. Thank you for watching this episode and take care of yourself.